To best grasp the political determinants of health, let's examine another hypothetical example that combines experiences of real people in urban and rural communities. Over time, we've gotten to know and appreciate Jessica, a young woman raised in a low-income housing environment, a community often overlooked and neglected by elected officials. For example, her living situations have often been dictated by predatory landlords. Their political pull in her district has allowed these landlords to trample tenant rights that would have prevented substandard housing situations. Jessica's personal salvation can be found in her 3 children, Wilson, 17, Francine, 11, and Jasmine, who has just celebrated her 2nd birthday. In every way, they are fiercely committed to each other, just as Jessica has worked so hard to maintain. There are, however, overwhelming obstacles for each of them, and Jessica has had to navigate the choppy waters of her worst nightmare, a contemplated suicide attempt by her child. Pressures can mount at any age and influence the way we see the world. It's so tough when these thoughts overwhelm teenagers. It's even worse when they threaten our younger children. How do political determinants of health affect our emotional well-being? Francine wants to attend her school's suicide prevention support group, though she is younger than most of its participants. Because funding has been drastically cut this year, fewer administrative personnel are available to maintain after-school programs. Her only option is an all-ages group that meets on Tuesday afternoons. Francine knows that her mom does everything she can to provide for her family, but their lives have always been financially strained. Jessica's minimum wage job at the neighborhood convenience store doesn't provide the necessities her family needs. As a result, Francine has only 2 wardrobe choices to wear to school. Kids in her class have noticed the redundancy, prompting many of them to ridicule her on a daily basis. With the state's free meal program significantly slashed, Francine starts most days with no breakfast and is embarrassed by the meager lunches her mom packs for her. And budget cuts have displaced the number of school counselors from 3 last spring to 1 this fall. With virtually no attention being provided to Francine's mental health, her feelings of loneliness and isolation have increased. Each day is an emotional obstacle course that she can barely navigate. Since she was 9 years old, Brianna has been abusing multiple forms of alcohol. In 4th grade, due to production costs and labor competition overseas, her parents lost their jobs at the shirt manufacturing plant. Witnessing her father's heavy drinking as he rotated in and out of jobs, Brianna echoed his behavior. It's taken her these past 2 years to realize that she's likely an alcoholic. Jose is the senior and most prominent member of the support group. As an only child raised by 2 mothers, most of his life has been filled with affection and loving doses of attention. Recently, however, new state laws have made Jose feel like having 2 moms has made him an outcast. Frustration with his mothers has grown at the same rate as the national spotlight has expanded on the subject. The more newsworthy these stories became, the less often his friends wanted to get together. Though initially difficult to manage, Jose has learned to better handle these pressures and admits to finding the support group a healthy release overall. But where is Viola? No one has seen her at school the past 2 days. Was her fear of her family's reduced housing choice voucher finally realized, forcing them to relocate to another city? Or were her family's disputes and instabilities too much for Viola to bear? It's Byron, the school's favorite algebra teacher and moderator of the support group, who inspires the kids' discussion. To do so today, he's brought Danny to the conversation. As everybody knows, Danny is a professional baseball player and former student within these hallways. When his sister was caught in the crossfire of a gun battle between neighborhood rival gangs, Danny started experiencing depression at age 15. Given his school's location and lack of prominence within the city, Danny received little social or psychological support. His baseball coach, however, could personally relate to Danny's difficulties and provided the guidance he needed to focus on both school and athletics. Danny steered his life back on track and excelled at his most personal pursuits to win the attention of colleges around the country. Majoring in American history, Danny realized that his college scholarship was a product of more than 60 years of federal acts and laws enabling kids of all backgrounds to pursue academic and professional success. It's never easy to measure how political determinants sway our personal health, especially on an emotional level, but being aware of their influence can serve to improve our well-being. What does this mean for all of us? What can we do to improve and mend our community's most damaged systems?